And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number on the lungs. So it'd be interesting to check that. When you do testing to that extent, you're going to find more people. You're going to find more cases. So I said to my people, slow the testing down, please. They test and they test. We got tests that people don't know what's going on.
Hi again, everyone. It's now 5 o'clock in New York. What do we get? What do we expect to get when we return that person back to the White House? At best, a fundamental lack of understanding about human health, where incompetence could cost lives. At worst, an administration that takes active steps to put profits and personal vendettas above what's best for the country. And in doing so, putting the lives of every American and people around the world at risk. Keeping people safe and healthy should be something we can still agree on even now. Things like stopping the spread of pandemics, ensuring that medicines are tested and safe before they're sold and available, funding research to find cures to diseases that don't discriminate based on your political party, things like cancer. And that's exactly what's happening. That's exactly what we're seeing the new administration take aim at. Washington Post reports this, quote, health officials and experts said this week they are reeling after the new Trump administration on Tuesday abruptly halted external communication at the Department of Health and Human Services and its agencies, including the Centers for Disease Control and Prevention and the National Institutes of Health, meaning things like meetings of scientific researchers, experiments, other sciencey stuff. It all stopped. Decisions about who to give grant money to for their work stopped. Travel for employees at HHS stopped. Communications that are relied upon to disseminate critical health information about ongoing stuff stopped. That happened this week. Former CDC Director Tom Frieden pointed this out yesterday. CDC's Morbidity and Mortality Weekly Report had provided real-time data and analysis about disease outbreaks and emerging health threats without a break every week since the year 1960 until today. Seems like a long time. The Post spoke with Victoria Seawalt, Chair of Population Sciences at City of Hope Comprehensive Cancer Center, who was scheduled to lead an NIH study section Thursday that was abruptly canceled without guidance on when it would be rescheduled. The session was scheduled to review grants focused on cancers and other chronic illnesses. She said this, quote, everything is basically in chaos, and frankly, everyone is terrified. We've never seen anything like this. This is like a meteor that crashed into all our cancer centers and research areas. That meteor, apparently all because this new administration wants Trump's people to monitor everything, including cancer research. A memo sent out by the acting HHS secretary, obtained by NPR, said this, quote, refrain from publicly issuing any document or communication until it has been reviewed and approved by a presidential nominee. So as health research and money and communications are stopped, paused. Trump also cut off the U.S.'s access to global health data when he pulled the country out of the World Health Organization in one of his very first executive orders. A frightening move as concerns over bird flu outbreaks are mounting. Alarm in the health industry is where we start the hour with some of our favorite experts and friends. Epidemiologist, health economist, and chair of the New England Complex Systems Institute, Dr. Eric Feigelding is here, plus critical care physician, professor of pediatrics and pediatric disaster response expert, Dr. Michael Anderson is here. Also joining us, senior editor for health and science at Forbes, Alex Knapp is here. Alex, I'll start with you on the reporting. We only learn of some of these shutdowns or pauses when they're public facing. I wonder if you can just help folks understand how vast the medical and the health and sort of the federal agencies that work in this area are, and how much more could be impacted that we don't know about yet.
Yeah, and thanks for having me on the show. It's important to understand that the NIH is almost $50 billion a year worth of the federal budget, and that goes to research hospitals. It goes to providing care. It goes to biotech startups. It goes to collaborations with pharmaceutical companies to develop vaccines against potential pandemic threats. There's really a wide-ranging number of things that it does, and in addition to disseminating public health information and making sure and tracking disease outbreaks.
Dr. Anderson, I wonder if you can sort of orient us around what even falls into the category of some transition. I mean, I guess none of it when it comes to NIH, because the transition landing team under a normal transition is there to make sure that the sciencey stuff isn't impacted. Just talk about how unprecedented this moment is for the medical and scientific community.
Yeah, Nicole, it truly is unprecedented. And yes, when administrations change, there are sometimes gaps or hiccups or whatever it is, because a new team has to learn rapidly exactly what's in their portfolio. But this shutdown, this almost complete shutdown, is really disconcerting. And a couple of the pieces you quoted, there's something called a study section. It's very sciencey, it's very medicine-y. A study section is a really important, I would say, vital part of the research chain. That is when learned scientists, physician researchers get together, they review the grants, and they figure out who's going to be funded. You know, in 2025, we sit in an amazing time in medicine, curing so many people with different types of cancer, advances in pharmacology and drug therapy. How do we get there, though? We get there through research. And how do we get research done? We get it through mostly funding by the NIH. So the notion that study sections are shut down for any period of time and the terror that people are reporting as researchers is really disconcerting.
Can you help us work backward, Dr. Anderson, from the consequences to what the motive could be? Why would you do this? What would you be wanting to do if you would do this much damage to medicine and science?
Yeah, it's tough to control. You're either naive to the scope of what you've asked to halt, or you want control. You want such line-by-line control that you don't trust the learned professionals that have been doing this for a long time, that have been advancing science. And it's tough for me to say what the motivation is. I just know if you're a researcher in the trenches and you've been working so hard to get that grant to study this new therapy for cancer, this news has got to be devastating. Now, I'll just take one quick sidebar. It is tough to recruit physicians to be interested in doing this kind of science, and putting up these kind of roadblocks or this kind of, cessation of activities. I think we could see long, multi-year ramifications of this.
Dr. Feigling, it would be naive to think that Trump's one brush with political calamity before, during, and after his one brush with public health is unrelated to what we're seeing. But I wonder, again, if you could take us through the consequences of the actions of just the last 5 days.
Yeah, this is, again, unprecedented. But to add to what Dr. Anderson was saying, study sections, the domino effect is not just on federal workers. People can think, oh, NIH workers. No, the domino effect is to actually squeeze universities across the country, because NIH is the #1 funder of university research and medical schools and schools of public health. And so this is in certain ways, for all the epidemiologists who told Trump he was wrong, this is his retribution against all these medical and public health scientists who said, vaccines work, we need to, do these precautionary things, wear masks. This is a retribution. And when he squeezes and shuts down these study sections, the domino effect is a lot of these scientists won't get funded for another half a year. The domino effect will be huge. And also, what's not been reported enough is that not only has there been this freeze, but the NIH has politically removed all grant awards for any racial disparities, and of course, LGBT disparities as well. So if pages that used to say, we will fund racial disparity research in cancer, heart disease, diabetes, anything mentioning racial disparities have now been deleted by the Trump administration. So it's during this phase, they're actually politically purging all NIH research that is not in their favor, not in their political, Project 2025 ethos, and of course, exact this retribution against all the public health and medical scientists who, he has vendetta against from the pandemic.
As the only person I think who's worked in the dirty business of politics, I would say nothing would be more popular than curing a disease, any disease. I mean, what?
You would think.
Yeah, I mean, what is the long-term consequence, and how does, if Trump wanted to put all this back together, how long would that take?
Well, to rebuild something after you burn it down takes a very long time. But right now, I think after the squeeze over, they say, well, it's a temporary pause. I've heard this, it's a temporary pause until February 1st. But the issue is these meetings, these in-person meetings actually will be probably rescheduled 2, 3, 4 months from now. And the impact of that research is, we're talking about medical research, clinical trials that cannot pause, but they're scattered around the U.S., around the world, trying to find cures for all these diseases, find cures and vaccines and treatments for these neglected diseases. So the impact on universities will be humongous. Entire university budgets might be frozen for quite a long period of time. But greater than the silence on scientists and other researchers speaking out. For example, CDC not publishing the MMWR report that Dr. Tom Frieden mentioned, first time in 60 years. It's devastating because now also, even if they restart it, there will be this eerie silence, this unspoken, you better not publish anything that we don't want you to publish, which, again, during the pandemic, we know the Trump administration muzzled MMWR scientific reports on the pandemic, or anything that he doesn't like. So they will have a huge chilling effect